welcome back to my channel. So today we're going to be doing a little get ready with me, but we're going to be doing it different this time. I want to talk about mental health, so I asked y'all what disorder y'all wanted me to talk about, and the overwhelming majority of y'all said body dysmorphia. So we're going to be doing a get ready with me and talking about body dysmorphic disorder. So I asked y'all to send me some questions that y'all had about body dysmorphia, so I'm going to be sitting down, doing some quick makeup, and answering y'all's questions. So the first question is, what exactly is body dysmorphic disorder? So BPD is an excessive preoccupation with some imagined defect or flaw in appearance. So basically people with BPD have this imagined ugliness where they see a defect in their appearance and other people don't see it. We think that they look remarkable, we may think they look normal, but to themselves, they think that they have a huge flaw, whether there's actually one or not. So this disorder is classified under the obsessive compulsive disorders and related disorders, but it used to be a somatoform disorder just because people actually thought that they had physical issues with their bodies in the DSM-4, but now it's an OCD and related disorder. So the next question was, what are some symptoms of BPD? Some of the more common symptoms of BPD would be constantly checking your appearance in the mirror. Now, this has to be excessive, so every time this person walks past a mirror, they're constantly looking at the mirror, or it could go to the other extreme where the person has basically a phobia of mirrors where they don't even want to look at themselves in the mirror because they have such a heightened fear of their appearance. Another one is hiding their body parts under scarves or hats or makeup just because they want to hide their skin or their perceived defect under some other physical object. So some other ones would be not leaving the house, especially in the daytime, and avoiding social activities. So people with BPD, if they don't like their appearance, they wouldn't want other people to see their appearance either. So a lot of them do end up staying housebound. Some other symptoms is constantly seeking validation and then not believing the validation when they get it. So just asking people if they're okay and then not believing people when they say that they are okay. Comparison is another big one where people with BPD compare themselves to people that they don't think have any defects. A lot of people with BPD also engage in compensating behaviors to compensate for their perceived defects. So this could be excessive tanning, excessive grooming, excessive exercising, skin picking, and like I mentioned before, fixating on mirrors just because they want to make sure that no more damage has taken place and see if anything's changed. People with BPD also have these ideas of reference where they basically think that everything that goes on in their world is somehow related to their perceived defect, when in reality it's not, but they can't, understand that. It's also really important to note that these people with BPD, to the outside eye, they are completely normal. They may even be beautiful, handsome, but they don't see it themselves. But it is important to note that to the public eye, these people don't have any defect. And for BPD, because I know some people may think that it sounds like low self-esteem or just people who struggle with body confidence, but for it to be BPD, of course, it has to interfere with daily life. It has to cause stress and be disruptive to their daily life and their relationships, work, and school. So there is a huge difference between just low self-esteem and being diagnosed with BPD. And a little fun fact is that BPD actually used to be called dysmorphophobia, which is the fear of ugliness, and it was represented as a psychotic delusional state. So it wasn't always seen as an OCD and related disorder. It used to be seen as a phobia. So the next question that I got was, what is the prevalence of BPD? The prevalence of BPD is actually really hard for us to estimate just because it tends to be kept secret. But the estimates that researchers have gotten does prove that it is a lot more common than we think. In a study done in adolescents, the prevalence was found to be about 2.2%, where adolescent girls were more dissatisfied with their bodies than boys. It is seen equally in both men and women, so there's a 1-to-1 ratio, but men tend to have more severe BPD, and they tend to focus on their body build, their genitals, their thinning of the hair, so their BPD is a lot more severe, where women just tend to focus on different body parts, and women tend to have more eating disorders associated with BPD than men do. Age of onset for BPD, it starts around early adolescence and it goes throughout the 20s, but the peak is around 16 to 17, so that does mean that there are a lot of high schoolers and teenagers who do end up getting BPD when they're around that high school age. And BPD is chronic, so it usually has a chronic course. And there's actually one study where a woman, she had BBD for 71 years, and it started when she was 9. So if it goes untreated, it can have a very long and very hard chronic course. So whether people know it or not, BBD is one of the more serious psychological disorders, and it is comorbid with things like substance use, depression, social anxiety, and especially OCD, since it is related to OCD. Suicide is also a very important topic with BBD because suicide ideation, suicide attempts, and actual suicide are very serious consequences of BBD. And there was a study done where 24% of patients with BBD ended up committing or attempting to commit suicide. So it's very serious. It is very hard for the people who have BBD and for family. So the next question that a lot of you wanted to know about was what causes BBD. This is actually really interesting because there isn't really much info on what causes BBD. Not much information or research has been done on family contributions, so we don't really know if there's a strong genetic link between BBD and having it in your family. And there also isn't much info on biological and psychological predisposing factors or vulnerabilities. So when it comes to the causes of BBD, there's not much to go off of, but there are a few theories that have surfaced. So one theory is psychoanalytic, and it does talk about the defense mechanism of displacement, where basically a person with BBD has this unconscious conflict, and it's too anxiety provoking for them to bring it into consciousness. So instead, that conflict gets placed onto a body part, and that is the body part that they tend to have a perceived defect or flaw with. A second theory on BBD is that there are some socio-cultural factors where basically if someone has a traumatic past experience, such as being teased or bullied or abused, that they would be more likely to be diagnosed with BBD because of that traumatic experience. So our next question that y'all wanted to know was, what are some treatments available for BBD? Talking about treatment for BBD, many individuals with this disorder are very reluctant to getting treatment, and usually it's the families of the person with the disorder that kind of force that person to get therapy, which shows just how damaging it can be to relationships, family, friendships, all of that. Before we get into the actual psychological treatments, people with BBD often do seek out treatment, but not necessarily the most effective treatment. So by that, I mean things like plastic surgery or dermatology. So people with this disorder will often try to go get plastic surgery on the part of their body that they're not satisfied with, or they'll go to a dermatologist. And this actually, believe it or not, kind of makes the problem worse. They come back feeling more dissatisfied about that body part. Those treatments are usually sought out by people with this disorder, but they don't actually get to the root of what the actual issue is. So when it comes to our two methods of treating BBD, the first one is medication. So basically drugs that block the reuptake of serotonin, which are SSRIs. So some of the most common ones would be anafranil or Lovix, and these drugs can be very beneficial to people dealing with BBD. That does show that medications can really help in the course of BBD. So the second most common way of treating BBD would be CBT or cognitive behavioral therapy. And one of the most common forms of CBT would be the exposure and prevention method. And this is basically where the therapist would gradually expose that person with BBD to situations that really make them anxious and make them think obsessively about their perceived defects. And then the therapist tries to help them find ways to cope with that anxiety. CBT is very effective in treating BBD, and especially when you combine it with the medication, people with BBD can get better. One more really important thing I wanted to know is how closely related OCD and BBD are. So the prospect of that's good, is that researchers can use OCD to kind of determine the etiology of BBD and hopefully get a better insight about what causes BBD. So that's a good prospect since so little is known about BBD. But that was pretty much BBD in a nutshell. So thank y'all so much for requesting this disorder. Hopefully y'all learned something new, got to watch a little makeup, little get ready with me. But if y'all have any other questions, just leave them down below, and I will see y'all in my next Get Ready With Me. Bye.